I'm here to introduce to you the latest consensus statements on preoperative medication management developed by the Society for Preoperative Assessment and Quality Improvement, or SPAQI. Hello, everyone. My name is Adriana Oprea. I am Associate Professor of Anesthesiology at Yale School of Medicine. I had the pleasure and opportunity to lead the development of consensus recommendations for two of the medication classes, the medications for neurological disorders and those for psychiatric disorders. As with the other consensus statements that were previously published by Mayo Clinic Proceedings, for these particular medications classes, we used a similar process to develop consensus recommendations. Given the scarcity of data in perioperative management of these medications, we used a modified Delphi process and a panel of experts in perioperative medicine from different specialties such as internal medicine, hospital medicine, anesthesiology, or pertinent medical subspecialties have been convened to develop these consensus recommendations. While for some of the medications, it is very clear that these should be continued, given the fact that a lapse in taking the medications perioperatively may lead to the exacerbation of an underlying disease for which these medications are prescribed, there are specific considerations for taking some of these medications classes perioperatively. What I would like to do is invite you to read not only our manuscripts, which describe mostly the way the consensus recommendations were developed, but also discuss data that support our recommendations, but also look at the detailed tables we have created in which we also address anesthetic and perioperative medication interactions and salient points for postoperative care. As I mentioned, the focus has been in creating recommendations for preoperative use, but we are also touching upon intraop and postoperative considerations. So just to give you an example, if you think about monoamine oxidase inhibitors, they're prescribed either for Parkinson's disease or for severe depression. Generally, when they're prescribed for depression, this is the last resort medication when the patient has failed multiple other medication classes. Traditionally, when prescribed for depression, the manufacturer has recommended discontinuing the MAOI 10 to 14 days preoperatively, given the numerous medication interaction this class of medication has. However, in the past 20, 30 years, there have been developments in anesthesiology with modern techniques being very safe. And generally, this class of medication is continued preoperatively. However, given the concern from our psychiatric consultants that it is possible that our perioperative colleagues that would take care of the patient postoperatively may not be as cognizant of the medication interactions, it may be also okay to discontinue the medication 10 to 14 days preoperatively to avoid this medication interaction with potential fatal consequences under psychiatric guidance. So for MAOI, when they're prescribed for depression, you're going to see the consensus statement recommend two different approaches, either continuing perioperatively with alerting the anesthesiologist the day of surgery that is staffing the case that the patient is on an MAOI, or discontinuing the MAOI preoperatively for 10 to 14 days under psychiatric guidance. Another example I can give you is SSRIs. Generally, SSRIs are a class of medication that is very well tolerated with very few side effects. However, given the serotonin-norepinephrine actions, it is possible that for certain procedures, SSRIs could lead to more bleeding. So While it is safe to continue SSRIs for the majority of procedures, there are some emerging data that for orthopedic surgery, there may be more bleeding, more of a risk of transfusion. That is also discussed in the manuscript. I'm just going to give you these two examples, and I'm going to let you enjoy reading our manuscripts. Hopefully you will find them helpful for your practice. With this, thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.